Hey folks, welcome to Transplant Helper Today. My name is Jim Merle. Today I want to talk to you very briefly about our mindsets, our attitudes that we ought to have when facing transplant, particularly when meeting with a potential transplant team for the very first time. Now I understand that most of you watching this program are post-transplant patients, and so you may not necessarily see the usefulness of this one, but I think you will, because this is hopefully going to be something you can then relay to someone who you meet in a waiting room somewhere and help them out a little bit. So just use this to help someone else if it doesn't apply to you. Now basically this topic comes up because just the other day I had a great opportunity to sit down with a potential transplant patient and her mother and discuss these issues. And these issues for them came up because basically her current cardiologist, who is not on a transplant team, she's not been referred to them even as of yet, but her current cardiologist has decided that transplant may be her only option, but he has in turn told her that she may not be a candidate because, as he says, and I quote, transplant teams are usually judgmental, and that when they see your attitude, which is basically, I don't want a transplant, they're going to turn you away cold, and they're not even going to evaluate you. Now, in the first place, I would agree with him on one thing, and that is transplant teams are judgmental, but maybe not in the way he's speaking of it. That is, they're not judging you on their vibes, they're not judging you on first impressions or anything like that. They're going to make judgments, but they're all going to be based upon the numbers. The evaluation process that maybe he didn't fully understand is all about the numbers. It's all about where do you really fall on the spectrum of a need for any type of transplant, whether it's heart, lung, liver, kidney, pancreas, whatever. They're going to do some evaluations based on numbers and real facts. And so for that, yeah, they're judgmental, but they're judgmental using facts, not just impressions. Okay, so get that aside. On the second thing, though, I want to add, though, before we go any farther, is that there is an extent and there is a place where our mindsets, our attitudes about transplant really matter, because part of the transplant evaluation process that I've already talked about here on the program, I can link to, it does have to do with our mental states. It does have to do with our psychological states. It does have to do with our attitudes, because we're going to be evaluating those areas. But those evaluations, psychological evaluations, are all surrounding your ability to deal with the pressure, to deal with the stress, to deal with the potential of transplant and living the post-transplant life. That's what that's really about. It's not to decide, where you sit right now in the moment. It's to decide where you might sit a year or 2 or 3 or 4 or 5 years from now if the transplant should come. So that's two things I want to mention in the onset. And then I want to add to it by really getting into this discussion. And that is that when you go in to meet your potential transplant team for the very first time, don't be afraid to admit to them that transplant's not what you want. Don't be afraid to admit to them that, transplant is not my first pick. I would say the majority of us out there who are post-transplant patients now, if we think back to our past, few of us, if any, went into the transplant clinics or that first visit and fell down at those doctors' feet and said, please, please, please give me a transplant now. Now, maybe if we understood it was the end of our road, if maybe we understood it was our only option hands down, maybe, just maybe, we might have done that. But again, that would be rare if it ever happens. No, most of us go into transplant clinics and we go to those doctors and we say, look, do a thorough evaluation, help me to make a decision, but if you can find a way around transplant, please help me find it. Please help me find another option. Please help me find out what my other opportunities are. Don't force me to a transplant that I may not even need. I think that's how most of us go in for those initial transplant clinic visits. And that's with just the mindset that I want to know what the facts are and I want you to help me make a decision. In addition to that, I think it's fine to go into a clinic and to admit to them, this is not what I want. I don't want a transplant. I don't want to live life like this. But then at the end of that, be sure that you clarify, however, I will do whatever I need to do to live. Now, eventually in the transplant world, that's going to be called compliance. That's where you're going to agree with the transplant team. If I'm transplanted, I'm going to be at all my appointments. I'm going to take my medications. I'm going to take part in all the procedures or follow-up testing. I'm just going to be, if you will, a good citizen in the transplant world. That's called compliance, and we do need that. And I think the better our attitudes are overall is going to be a lifesaver and a tremendous factor in how well we recover and how long we survive. However, having a mindset right now, pre-transplant, of I don't want this, I think that is so normal. I think the doctors see it so much, they're not even going to, as we might say in this world, sweat it. They're not going to be bothered by it. Go in and be honest, be open, be sincere, let them know how you feel. I think that is by far our best option. If this has helped you in any way, how about like, subscribe, and share? Even consider hitting the bell notification down here right beside the subscribe button so you can be notified through YouTube anytime new content comes out, which I'm typically trying to do on Tuesdays and Thursdays, albeit I'll throw in a few extra episodes of bonus here and there. Thank you so much for watching today, and certainly until next time, stay stronger, friends.